Today, we will be covering the surgical treatment for severe obesity. There are two surgeons, Dr. William Fuller and myself, Dr. Leanne Lim. First of all, let's start by going over what obesity is. The simple definition of obesity is having too much fat, specifically an unhealthy amount of fat. The National Institutes of Health has confirmed that it is a chronic and progressive disease process that has many factors that contribute to its prevalence and severity. Now, there are also many causes of obesity. It's a combination of both individual as well as environmental factors, ranging from finances, work or school culture, lifestyle planning. There are also a variety of individual factors such as stress, exercise, hormones, nutrition, and genetics, which has a significant impact on a person's propensity for obesity. Now, the prevalence of obesity is approximately 42% per the last CDC survey in 2021. Of these, 9% have severe obesity. They found that weight loss programs tend to be temporary only, and patients often gain back their weight and more, particularly when they come off of whatever medication regimen they're on. Surgery provides the only long-term success. Obesity puts you at risk for many diseases, which is the main health issue with obesity. Diseases include diabetes, high blood pressure, heart and lung disease, high cholesterol, stroke, joint problems, sleep apnea, and even 13 types of cancer that you can see here. Now, who qualifies for bariatric surgery? The updated American Society for Metabolic and Bariatric Surgery have included anyone with class 1 obesity and a BMI of 30 with an obesity-related medical problem, or anyone with obesity class 2, which is a BMI of 35 and above. Now, body mass index is one of the objective measures that we use for obesity. It is your weight divided by the square of your height in meters squared. Now, that gives you a number ranging typically from anywhere from 14 to above 40, 50, 60. Those with a BMI above 30 have obesity, and that is broken up in 3 further categories. But anyone with obesity, depending on if you have a medical comorbidity related to obesity, can qualify for bariatric surgery. Here at Scripps Mercy Hospital in Hillcrest, we are a metabolic and bariatric surgery accredited center. This means that we have voluntarily undergone an independent and rigorous evaluation in accordance with nationally recognized bariatric standards, and we're dedicated to maintaining strict standards to improve the quality of care our patients receive. Since the beginning of the Scripps bariatric program, we've actually completed over 20,000 bariatric surgeries since its inception. We have a comprehensive and multidisciplinary approach with providers and staff who are trained in caring for a bariatric population. This includes a facility with appropriate equipment for bariatric patients, an internal medicine team, and anesthesiologists who are also trained to care for the common medical problems that our bariatric patients face. We have evaluation by our partner psychologists to ensure that you're ready for this next step in your journey. We also have really passionate, dedicated bariatric nutritionists who help provide patient education. We also have monthly support group where patients can discuss common issues before, during, and after surgery amongst peers who've gone through the same process. These are all things that make Scripps an MBSA QIP accredited bariatric surgery center. Now, there are two surgeries that we offer here at Scripps. The first is a Roux-en-Y gastric bypass, and the other is a sleeve gastrectomy. Typically, we do this in a minimally invasive way, either robotically or laparoscopically, with the small incisions and the instruments you see here. For minimally invasive surgery, as I mentioned, you have much smaller incisions, less pain, and a quicker recovery. Very rarely do we have to do the open up and down incision that's seen on the right. First, I'll start by going over the sleeve gastrectomy. This is where we cut out approximately 80% of your stomach and physically remove it from your body. This works in two different ways. Number one, it causes hormonal changes in your body, which can help control your appetite. And number two, it causes restriction because your stomach is now shaped like a thin banana. You cannot eat as much because you feel full very quickly. The other operation is the Roux-en-Y gastric bypass. Here, we separate a small egg-sized pouch of stomach and we reroute the intestines up to that small pouch. This actually works in three different ways. The first is also hormonal changes to help your body feel full and have decreased your appetite. The second is also restriction, but even more since your stomach is now the size of a small egg versus a banana shape of the sleeve. And the third, and the main way it works is that you don't absorb any calories in about 3 feet of intestines. Because of this, patients do tend to lose more weight, but we are doing more to your body. Now, which surgery you have will be a discussion during your consultation with your surgeon. Now, any surgery or procedure in medicine has its own risks. The main benefit to you would be an improvement for your health and a decrease in weight. Potential complications do include infection, bleeding, blood clots, leaks, strictures, ulcers, dumping syndrome, and even a very, very small chance of death. The Roux-en-Y gastric bypass has an individual risk that's called an internal hernia, and the sleeve gastrectomy has an individual risk, which is predominantly acid reflux or heartburn. Now, each of these, again, will be reviewed with you at your individual consultations, as patients do have medical problems that put you on more risk of some things versus others. In 2022, which is our most recent data, the Scripps Mercy completed 1,041 bariatric surgeries, and our most common complications are below 4.1% rate of readmission. And typically, this is for dehydration. That's the most common reason why patients come back to the hospital. And our leak, we had 0 leaks, and bleeding is far less than 1%. Now, just to review, we offer 2 surgeries, the Roux-en-Y gastric bypass on the left and the sleeve gastrectomy on the right. And you'll go over your entire medical history with your surgeon and determine which surgery is right for you at that time. Now, after you have surgery, how do we measure how far you've come? Of course, we can measure the specific number of pounds, but we also look at body mass index as well as percent of weight loss. And we also want to remind patients that non-scale victories are often a significant role that patients often overlook when they focus on just the scale. And non-scale victories are things like just cancer reduction, just the risk of that, coming off of a lot of medications that you may have previously been on. Improved fertility, improved quality of life. A lot of patients say that they have so much more energy after surgery, after they've gotten some of the weight off, and they are able to interact with their kids or grandkids. And overall, it just increases your life expectancy. Now, how can you start getting ready for surgery? I think having a positive mindset and even coming to our support groups before surgery is a great idea. Like I mentioned before, you can hear from patients who've gone through our process just to know what to expect. You can start healthy eating habits now. We always encourage our patients to start eating protein first. Eat slowly with small amounts because after surgery, you can only do a small bite at a time. Make sure you chew well and just practice sipping water frequently throughout the day because, again, you can only do small sips after surgery. It's not like before surgery when you can drink an entire cup of water at one time. It's also a good idea, even now, to start exercising to get yourself into a good routine and a good habit that you can maintain after surgery. 30 minutes of walking a day, 5 days a week is a great way to start. And also start a daily multivitamin. After surgery, we do recommend that you take a bariatric vitamin daily to help maintain your nutrient levels. Now, bariatric surgery is a journey. Right now, all of you are in the pre-surgery phase during doing preparation for surgery, which includes coming to our webinar, meeting with a surgeon, getting medical clearance as well as psychology clearance, starting your healthy eating and exercise habits now. And once you get a surgery date, we also have a pre-op preparation class for you to attend. Surgery is really only a short part of the journey. Typically, patients will just spend one night in the hospital and are able to go home the next day. The immediate post-operative or post-surgical recovery period is when we progress your diet and you are establishing these new lifestyle habits that you'll carry the rest of your life. And forever is routine health maintenance with primary care annual visits to us, and following up with your nutritionist and psychologist is needed, as well as doing annual blood work to make sure your nutrient levels are good. Now, there are some things to avoid after surgery. For the first year, that includes pregnancy, caffeine, alcohol, red meat, juices, gum. And for life, we do recommend that you avoid NSAIDs or non-steroidal anti-inflammatory drugs. Aspirin, if you can, is an NSAID that we would like you to avoid. Smoking and carbonated beverages. These are just general guidelines. Now, bariatric surgery is a tool that needs your lifelong commitment. It's only with the efforts that you put in after surgery is how you maintain a successful, healthy lifestyle after surgery. Thank you, everyone. Let's continue your weight loss journey together. And now I will open it up for questions. And if you don't have questions, you're welcome to leave the webinar.